Biomedical waste management is a critical discipline within healthcare and laboratory settings, focusing on the safe handling and disposal of materials that may be contaminated with infectious agents. This field is essential for protecting healthcare workers, the public, and the environment from potential pathogens. Proper management involves a systematic approach to identification, segregation, and treatment of waste. In this session, we will focus specifically on the high-risk scenarios involving accidental releases of these materials. Understanding the foundational principles of biomedical waste ensures that every subsequent protocol is executed with the necessary caution and scientific rigor required for safety. Biological Spill Management Protocols, designated as Lesson 09, outlines the standardized procedures for responding to accidental releases of biohazardous materials. These protocols are designed to minimize the risk of exposure and environmental contamination when a spill occurs. Managing a biological spill is not a simple cleaning task. It is a technical procedure that requires specific training, equipment, and a disciplined sequence of actions. This lesson serves as a comprehensive guide for personnel to ensure that biological hazards are neutralized effectively while maintaining the highest safety standards for the response team and the facility. Containment operations, under Lesson 9.1, establishes the fundamental mindset required for spill response. A biological spill, such as blood or laboratory cultures, is an acute biohazard emergency that demands an immediate and structured response to prevent the spread of pathogens. It is vital to understand that these situations must be treated fundamentally differently from routine janitorial cleaning duties. While standard cleaning focuses on aesthetics and general hygiene, containment operations focus on pathogen inactivation and the prevention of transmission, requiring specialized disinfectants and rigorous adherence to safety barriers that go far beyond standard housekeeping practices. Immediate isolation is the focus of Lesson 9.2, representing the first active step in spill response. You must secure the perimeter immediately and prevent unauthorized entry to ensure that bystanders do not accidentally track the material through the facility or become exposed themselves. Furthermore, it is mandatory to evacuate the room if viral aerosolization is suspected. This evacuation allows droplets to settle out of the air and onto surfaces, which significantly reduces the inhalation risk for the response team. Waiting for this settling period is a critical safety measure before any physical cleanup or containment begins. Personal protective equipment, or PPE, is detailed in Lesson 9.3 as the primary defense for the responder. Responders must don comprehensive barrier gear before intervening in any spill area to ensure no skin or mucous membrane contact occurs. This equipment includes fluid-resistant gowns to protect the body and double gloves to provide a secondary layer of protection in case the outer glove is compromised. Additionally, face shields are required to protect against splashes, and N95 respirators are essential to filter out any remaining airborne particles or aerosols that may be present during the cleanup process. Peripheral containment strategy, outlined in Lesson 9.4, describes the physical method of stabilizing the spill. The first action is to cover the spill with absorbent pads, which helps to soak up the liquid and stabilize the volume of the material. When applying these pads or cleaning, you must work methodically from the outer edges towards the center. This specific direction of movement is designed to prevent capillary expansion, which is the tendency of liquids to spread outward when disturbed. By starting at the periphery, you effectively corral the biohazard and prevent the contaminated area from growing larger. Organic load neutralization is a critical chemical concept discussed in Lesson 9.5. A common mistake is the misuse of disinfectants. You should never pour bleach directly onto heavy organic spills, like large volumes of blood initially. This is because the heavy protein content in the blood instantly neutralizes the active chemical ingredients in the bleach, rendering the disinfectant ineffective before it can kill the pathogens. The organic matter essentially acts as a shield for the microbes. Therefore, the bulk of the organic material must be managed or absorbed before the final disinfection step can be truly successful. Chemical kinetics, found in Lesson 9.6, explains the science behind effective disinfection. Once the spill is covered, you should pour approved disinfectant over the absorbent material to begin the decontamination process. It is not enough to simply apply the chemical. You must enforce a strict, uninterrupted contact time of at least 15 minutes. This duration is scientifically necessary to allow the chemical agents to breach cellular walls and viral capsids. Cutting this time short may result in surviving pathogens, so timing must be monitored precisely to ensure the area is truly rendered safe and non-infectious. Safe debris removal is the subject of Lesson 9.7, focusing on the prevention of physical injury. During the cleanup, you must utilize mechanical tools, such as tongs or rigid cardboard, to extract saturated materials and debris from the floor. You must never use bare or gloved hands for this task. The primary reason for this strict rule is to prevent concealed sharps injuries. Broken glass or needles may be hidden within the saturated absorbent pads, and even heavy-duty gloves can be easily punctured, leading to a direct percutaneous exposure to the infectious material being cleaned. Waste integration, detailed in Lesson 9.8, addresses the final disposal of all materials used in the process. All cleanup debris. Because of this high viral or bacterial load, these items must be immediately discarded into designated yellow or red biohazard bags. This ensures that the waste enters the correct regulated medical waste stream for high heat treatment or incineration, preventing the hazard from re-entering the general waste system or the environment. Thank you for completing this module on biological spill management protocols. By following these rigorous steps, from initial isolation and donning PPE to the methodical containment and final disposal in biohazard bags, you play a vital role in maintaining a safe environment. Consistent application of these protocols ensures that even high-risk accidents are managed with professional precision, protecting yourself and your colleagues from the dangers of infectious materials. Please ensure you are familiar with the location of spill kits in your specific facility and remain prepared to act according to these safety standards.